inflammation. When you think about inflammation, you could start with the acronym HERP, heat, edema, redness, pain. Let's see how this happens. So you have a trauma, could be an injury, could be an infection. And with that, you're going to have hyperemia. And hyperemia, hyper means more, and emia is referring to the blood flow. So you're going to have increased blood flow to the area. With increased blood flow, you're going to have heat in the area because blood carries heat. Well, how does the increased blood flow occur? You're going to have basophils, which are circulating through the bloodstream, and you're going to have mast cells, which are localized in the area, and they're going to release the chemical histamine. And histamine is going to cause the vasodilation. Also, with the increased blood flow, you're going to have an increase of red blood cells arriving to the area, erythrocytes, and that's going to cause redness. And then also you're going to have the nerve receptors there in a location of the injury or the infection that are having pressure, or maybe there's prostaglandins released, but they're going to stimulate those nerve receptors and you're going to experience pain. Let's take a look at the notes. So again, the acronym is HERP. If you like acronyms, we have a trauma or infection. We have hyperemia, increased blood flow. That's going to bring heat. How does that occur? Well, we have basophils or mast cells that are releasing histamine. And that's going to, histamine is going to result in vasodilation, which is going to result in edema, swelling. And then we have increased blood flow. We're going to have the erythrocytes arriving to the area, the red blood cells, and that's going to lead to the redness. And then we have the nerve receptors in the area. And that with the stimulation of nerve receptors, we're going to have the pain, experience the pain. So let's go without the notes. Think you can do it without the notes, you remember? Inflammation, acronym HERP, heat, edema, redness, pain, resulting from a trauma or infection. Hyperemia, hypermore, increased blood flow. That brings heat. Vasodilation, how did that occur? Basophils or mast cells. Basophils, again, are circulating the blood. Mast cells are local within the area. And they're going to release histamine, which is going to cause that vasodilation. With that increased blood flow, we're going to have red blood cells arrive to the area, and that's going to contribute to the redness. The nerve receptors on the neurons are going to be stimulated and will experience pain. And that could be from pressure on the nerve receptors. It could be from prostaglandins being released. Thanks for joining me.